Hi, everyone. Thanks so much for joining us for another edition of the ABP, broadcasting live from beautiful Amherstburg, Ontario, on another Tuesday evening as we enter the month of April. Happy to have you along for the ride. We are live this evening on Facebook, Instagram. I keep saying Instagram. I want us to be on Instagram, but it's like a weird connection with the program I use. I should say LinkedIn and Twitter. The rebroadcast will be up on YouTube and Apple Podcasts this evening. So, yeah, lots to talk about, lots of things to chat about today, and another phenomenal guest that's going to join me in the next couple of minutes to talk a little bit about a topic that is near and dear to my heart and how it sort of transcends different realms of workplaces. The topic of communication. So we'll get to that in the next couple of minutes. But before we do that, a couple of things on the horizon. We've got Easter weekend coming up this weekend. I know that you're just as excited as I am. Easter is one of my favorite times of the year, and hopefully you are going to celebrate safely, despite the fact that we are still in a global pandemic. And always a great reminder, too, Mother's Day around the corner. And don't forget that this show continues to raise funds for some great charities here in Windsor, Essex. We're brewing some good news. We've got season 2 ABP mugs available right now, $20. These are highly collectible, dishwasher safe, microwavable safe. 100% of the proceeds go to benefit two charities near and dear to my family's heart. Of course, the Windsor Essex County Humane Society and the Ronald McDonald House at Met Hospital. So if you want to hook yourself up with these mugs, I can certainly bring them to you, or you can contact my good friends Glenn and Kim, our swag partners here on the show at Hag Customs. You can find them on Facebook as well. I'm just saying, if mom likes coffee, she may want to pick up one of these mugs ahead of Mother's Day, which will be here before you know it. Speaking of mothers and fathers and family members, when you have folks in your life that you love that are getting elderly or they're becoming frail is not the word, but perhaps more dependent on their relatives and their sons and daughters to help them navigate healthcare challenges. If they're going for specialist updates, if they're going for any kind of procedure, communication is a huge factor of a person feeling good about themselves post recovery and obviously through the whole process and getting their ailments taken care of. And communications in healthcare, it remains one of the top 3 reasons actually for patient complaints in the healthcare system. Patients are asked what they value most from their service provider. They often seek somebody who cares, somebody who's compassionate, somebody who takes the time to listen and explain things clearly. So my guest tonight is a compassion-focused physiotherapist with vast experience in the public and private sectors of healthcare. She's got 14 years learning and reflecting on the importance of communication in our health and even educational systems. And she is a mentor to future and current health providers on discovering their purpose, achieving fulfillment, and creating empowering patient experiences. True story, I actually met and worked with her during my time in healthcare. I found her work to be extremely rooted in genuine people-driven service. It's a simple concept, but one that can have massive reach when it's applied correctly. She's an author too, and she's got one hell of a read if you're looking for something that can sort of translate into your particular profession that you're in. The book is called Communication is Care. It's a great read. Jennifer George is joining me here on the live stream. Jen, always good to see you. Thank you so
Hi,
much for spending
Aaron.
some time with me tonight.
I'm so excited to be here with you today. Thank you for all you're doing in this community. You're always shedding some positive light in
Uh,
today's world, which can be dim sometimes. So thank you. I'm excited.
well, I, coming from you, that means a lot. I do what I can, and I had conversations with some folks today about what it means to sort of do what you love, and having those conversations with people to sort of break down the process. Sometimes I think we're so stuck in process and really see the trees from the forest, if that makes sense, and really
Mhm.
identify with people. And listen, like you and I said, if there's one thing in COVID that I have found has been a blessing for me is the ability of technology to do shows like this and do content like this from the comfort of my home studio. I
Yeah.
was just teasing you. I was just put
Yeah.
Liam to bed 2 minutes ago and I ran down. I'm like, oh, I got a show with Jen, got to log on. But
It's
it's
amazing.
that face-to-face contact and really spending time with folks too, I think is so crucial. So before we
Mhm.
get into your, I'm going to say kick-ass book,
Yes.
um,
Thank you.
let's talk about your service. I mean, you are a healthcare worker. You are somebody who has seen all facets of the healthcare profession. Tell me how your journey has started, and in your connection to sort of communication in general.
Yeah. So my journey started in 2007 as a physiotherapist. And at the same time, my father fell ill kind of suddenly. So he ended up in hospital for almost a year with chronic illness. And basically, at the onset of my career, my dad was coming home. And that's when I became a caregiver, moved back home to help my mom care for him. And I was starting my career as a physiotherapist. And at that time, I was working in private practice and in hospital. Uh, so for many years, my dad lived for 11 years longer than anyone ever expected. Um, Much of my career I owe to my caregiving experiences and watching my dad's journey and witnessing the interactions day to day with healthcare providers from the home care setting to the hospital setting to the primary care setting, an outpatient setting. And every interaction was really a psychological experience, right? It was really, it was really what predicted our outlook as a family, and also my dad's ability to recover. So whether so if the interactions were not so great, if they were negative in ways where we felt unheard, where we were perceived perhaps as barriers at times as caregivers, that impacted, his journey and ours as well. And in those moments where we felt heard, where we had, empathetic connections and compassionate care, that really uplifted us and that made us hopeful. And yeah, and it impacted his recovery and outcomes along the way.
So you saw it not only from somebody who provides that care, and I've always maintained, and I still maintain. I mean, what really struck home for my family is I've been blessed. I mean, I'm 40 years old, and I haven't had any major medical issues. Knock on wood.
Knock on wood. Yeah.
Same with my wife. My wife is 37. Same with her. But obviously, Liam, we went through the gamut from Met Hospital to London Health Sciences to sick kids. And I remember advocating along the way, especially at a local level, that, something wasn't necessarily right with my son before he was diagnosed with his heart defects. But then, I do remember vividly, we still remember the nurses that we dealt with at London Health Sciences and certainly at Sick Kids, who took time to kind of walk through the process, right? I mean, to them,
Hmm.
I don't want to say it's just another job, but it's another day at the job. But, for parents of a sick children, and in your case, children of a parent who is ill, um,
Hmm.
generally speaking, this is all new to you. You're like sort of deer in
Right.
headlights. So to have somebody to kind of say, hey, how are you feeling? Can I answer any questions for you? Is there something that I can offer you to kind of ease that sort of fear, I guess?
Yeah, I can relate to that in a lot of ways because so leading up to my dad's illness, so that would have been like 2006, I was in school and I remember arms like you. I was so grateful. I was so in tune. I'm the youngest of six children. And I was so aware of the fact that my parents were in their 60s and they were independent and they were in our lives and they were healthy and well. And I was always grateful for that. And so when this happened to my dad, when he suddenly needed these liver transplants, and it led to a brain injury as well during the surgery, um, and chronic other complications along the way. But yeah, like it was new to us. So as a healthcare provider now, I can empathize with patients and caregivers because it's life changing. And even though we in healthcare we see it all the time because it's our work, right, to provide service to people who need our care. We don't know what it's like to be on the other side going through it and how transformative that can be to someone's life and turn things completely around. So, like you said, I think time is like the greatest resource we can give right now and the greatest gift we can give. And I've always felt like patients have sympathized with providers, even pre pandemic, that we are busy, that,
Sure.
like I feel like people have always sympathized with that. So if we could take a moment to establish a compassionate connection, which the literature says is under a minute, which we all have, if you can establish that rapport and show someone that you're taking the time to listen, that goes a long way. You don't even have to lay a finger on someone necessarily, right? When we think of physio and our manual skills and things like that,
Sure.
just being present is more than half of it, I would say, and affects the patient experience.
it's um it's a real skill set, right? It's something I think where you can find that common ground. And I know certainly, I mean, for you folks, and I've said this many times for healthcare providers and nurses and physiotherapists and doctors. I mean, my God, and throw a pandemic in that. It's like I can't even fathom. I mean, I have a
Yeah.
general idea, but I can't fathom the workload and the stress that's on board. But to take that one, like you said, that 60 seconds
Mhm.
to maybe diffuse a situation, or just, okay, say there's a diagnosis, or maybe there's not the greatest news coming out, and to kind of read the room,
Right.
so to speak, to kind of spend that extra time. It's
Right.
amazing what that does, right?
Right. So, those interactions that I experienced as a caregiver, I always felt like, even though the news is hard to hear, even though the news isn't always positive, why can't we communicate it in such a way that, it's collaborative, that it is compassionate, that there is some time given and allotted to the conversation, to the situation at hand. Um, I'm really a big fan, like, advocate for patient and partnerships, right? I'm really visible to patients and families. That's something I hold dear because it's something that I went through personally and can relate to. So, and these are the things that people are saying that they want to see more of. Back then in 2008, you didn't see much. Like, I was in my mid-20s as a caregiver, you didn't see people talk about it like you do today. So it's so nice now to see that there's more advocacy out there on the caregiver side, saying that they wanna be a part of the patient care and that they wanna be a part of their loved one's care and help facilitate the transition as best as they can. Um, yeah,
So,
to be an active partner.
Jennifer, you go through this with your dad, and
Mhm.
you're a healthcare provider as well, and then you take your experiences with your family, and then you work on this amazing book that
Thank you.
I am happy to say I'm working my way through, and some of the lessons in here can apply to any particular industry. As I'm firmly loving some of the 9 steps here, on how you can kind of find that care is essentially communication, and communication is care. But
Mhm.
you're writing this, and this is in 2019. This is before the world ends in March of 2020. So did
That's
you?
crazy.
It's crazy how that all sort of worked out, right?
It really is, actually. You just gave me goosebumps talking about that. So my dad passed actually in May of 2018. So, um, and then, so that would have been, yeah, May 2018. Then I kind of had in the fall of that year, like this sense of urgency arms. I've always been a writer. I've always loved to write, just more on my own recreation and passion and outlet. But it really came to fruition kind of, I don't know if it was a sign from my dad, truthfully. It was one of those feelings where it was like, you need to talk about this and you need to do it now. And I've never had that experience any other time. And I wrote the book. I saw it so clearly what I was going to include in it. And it was like everything I ever experienced when my dad was alive just came flooding.
Flooding
Yeah,
in.
like the gates just opened and it was a bit of a flow, I guess you can say. I
Sure.
knew exactly what the strategies would be, and the strategies very much include the healthcare provider as a part of that interaction and that piece as well, and their well-being, and how important it is to the communicative experience and rapport.
It's therapeutic for you then.
Yeah, it was definitely my way of healing, I think, and my way of staying connected to my dad,
Mhm.
and also my way of seeing the bigger picture and being mindful of that. Like, throughout the chaos of our day, we have hundreds of interactions probably in our day when you think about it, whether they're seconds long or whether they're minutes long. It just grounds me when I think about just being present to the person before me. It just If I stay true to that purpose and intention and I can go home thinking that, I feel fulfilled as a provider.
Jennifer, and I want to speak for you. Right? I think you're
Mhm.
so eloquently well spoken. You're a fantastic author. I mean, I love the book.
Thank you.
You hooked me up with a copy, and I've been reading it on my lunch breaks, and I think the strategies in it are phenomenal. Um, you talk about being present and mindful. I don't know about you, but like certainly for me, it's one of those things where I always used to feel like I was on a hamster wheel mentally,
Mhm.
and I could never really focus on the here and now. There was so and my God, with COVID, there's, I mean, you pivot left and then you got to pivot 5 times to the right. And, you turn yourself about, you don't know where you are. But it's
Yeah.
like, if you can sort of micro schedule those interactions to say, what am I doing here now? How can I
Mhm.
make a difference in somebody now? I find that it's I try to really do that with a lot of conversations I have with folks during the day, whether it's, talking to donors or even some interactions with even my son's daycare providers too. It's just like,
Mhm.
how can I connect with this person in the moment? And it's a beautiful thing because I find that I'm really become inquisitive and I start to lose myself in that moment with that person.
Right.
I'm really starting to be aware that I'm here. I'm now. Again, for me, it's very easy when I do these shows. I like to interact with my guests. I said to you, I miss doing, a lot of the broadcast stuff, but it's incredible where you can kind of forge those connections on an unspoken level when you say, okay, yeah, I know I've got a ton of work. I know I got all the stuff I've got to do. My boss is chirping in my ear when I've got all these projects that but no, I'm here with this person who needs me now. I mean, again, my interactions are just talking to folks, but I mean, as a
Right.
healthcare provider like yourself, you're really trying to connect to that person on that emotional and even physical level too, to get them to a better place.
Exactly. Like nowadays, when you think of the determinants of health, it's so much more than what it used to be. Like there's social determinants, there's emotional ones, spiritual ones, financial ones that we see all of the time, every day in healthcare now. And so we, as one provider, we can only do so much. So I think if we as providers can add value in the moment where we're at and still help our patients navigate the system so that they can seek the next provider and continue to work on their goals or continue to seek services or advocate for themselves along the way, I think we've done them a huge service in doing that. I think that we kind of undermine our ability to do that and how powerful that really is when you can empower a patient to use their voice to be engaged in their care moving forward. I think that does just as much healing for someone as it does just in the moment of providing a treatment, let's say, or intervention. So, especially nowadays with the way the system is so complicated, I guess you could say,
Yeah,
and
I mean,
navigating it.
I mean, I geez, there's so much to unpack with you tonight. Like,
I know.
and
Eh?
I like
We could do
it's
a
just
part two.
because we will do part two. I'll tell you that right
Yeah.
now. But no,
Yeah.
I listen. I am all, and I do this on my face because like sometimes, uh, listen, metrics are good, and I am all about metrics. I think you what gets measured gets managed, but people are
Mhm.
not numbers,
Right. Thank you.
right?
Thank you.
Like, and
Yeah.
right, and like, and
Yep.
I'm not a healthcare, but people, and any success that I have seen in my life in my 40 years and like it's about people, right? And you have to treat people with respect. You should treat people with respect. You should be able to connect with somebody. It's that old adage, right? Walk a mile in someone's shoes. And I'll use
Mhm.
Liam as an example too. I remember when uh he was going for his second heart surgery, Jennifer, and it was open heart. And I mean, my wife and I are like deers in headlights. They're telling us this. I still remember to the day the nurse who talked to us after the initial heart surgery discussion with the doctor, who pulled us aside and said, "Listen, we do these. It is a risk, but you're in the hands of so and so is doing this and so is doing this. And if there's anything I can do, you let me know. I'm just around the corner. I'm going to watch him overnight. I'm going to see if you." I remember
Wow.
that to this day, and that was
Wow.
5 years after the fact. So it's
Right.
incredible to see what a little bit of that kindness does for somebody, because that sort of reverberated towards my wife and I. So we were like, okay, I mean,
Yeah.
this is still stressful, but we can manage.
Yeah, they care, and they sensed your emotional, discomfort, right? Like, you were uncertain, you were scared, you were worried, and that was sensed, and they also approached you on that, right? And I think we have to have those conversations more about how people are feeling, how they're coping, how their mood is, and, what their concerns are and how we can better support them. One of the things I like to do, before a session and after a session is add a personal touch. Just a personal touch, whether, it's asking about family, it's asking about their careers, their hobbies, or even just grabbing them a glass of water, a patient, those personal touches, I think, beginning and end, again, just take moments, and I think they mean so much. I have the privilege and where I work to spend quite a bit of time with people, but it gets busy, and I hold I hold so deeply the belief that things always work out. I have a very optimistic frame of mind, and when I struggle sometimes with providing, the same amount of care time for someone as someone else, I recognize that everyone's different. And I recognize that it's not about me and that it's about the patient I'm working with and what they want to focus on and what their goals are. And sometimes if I spend a little more time with one person, and a little less time with another, it all ends up working out. And I go where I'm needed most, and where my support's needed, and it kind of just flows that way. It's not always easy, and I think connection and communication and building that rapport is one of the hardest things. And sometimes in education they refer to them as soft skills, and I think
Sure.
they're and I think that is so undermining. I think that they are a core skill set to tap into someone's emotions and to empathize and to listen, empower, and to focus on solutions. That's a hard thing to do day to day when you're dealing with the misfortune of others a lot.
Yeah, and it's like an emotion. It's emotionally charged. I mean, a lot of these health situations for folks is
Yeah.
very emotionally charged, right? And then you know, as healthcare providers, you guys are being asked to do a lot
Yeah.
with a limited amount of time, a limited amount of funding,
Hmm.
in the middle of a global pandemic,
Hmm.
when protocol is being changed left and right, and policies being changed at a breakneck pace too. So it
Yeah.
is really, and I mean this with the utmost sincerity, it is very much a superhero feat to pull off what can be done for a particular patient. But again, like you said, when it's done right, I think it can have lasting effects too. So,
Hmm.
my question to you, Jennifer, why isn't this more widely adopted?
Yeah,
Like,
that's a
why
good
do you think that
question.
this is not something that has been, they look at metrics, they look at budgets and all that, and if it's a people based service, which it is, why isn't this adopted more?
Um, I can't speak for organizations or systemically as to why it's not. I think there's a recognition that the definitely that we appreciate the patient care experience, and that we encourage voices to be heard and said, and we want to know what people are feeling. But I do think it needs to be invited. I think we need to have more of an invited discussion, a collaborative discussion. I think we're focused a lot on outcomes and not necessarily the process along the way, from the moment the person comes in to the system to the moment they leave. What was that experience like for them along the way? And we as providers along the way can keep tapping into that. As we're in the presence of a patient, we see it firsthand, we hear it firsthand. And so if things are not going the way that they intended, we can intervene, and we can provide support, and create a solution that's mutually agreed upon with them.
Mhm.
I think that we need to focus a lot more on the process and the experience rather than just outcomes. I mean, in my education, all we were taught about was outcomes, and we've become so conditioned to think about outcomes. But what about those interactions along the way? Right? Like, what about those day to day experiences or those moment to moment experiences, depending on where you work?
Mhm.
And how do those, I don't know if it's just too hard to capture, like, but
I think
or to make it
I,
objective enough. I don't know.
I and I'm not out there saying calling the kettle black or anything like that, but
No.
I definitely think like it's like you said, to go back to the conversation where we were talking a little bit about that soft skills. And
Mhm.
yeah, I think it's, unless you're strictly using computers, and even then,
Yeah.
like everything is people based, right? And I
Right.
think, especially if you're in those situations where somebody's coming in when they're not feeling great, or they're in a life and death situation, it's walk a mile in my shoes and see how it is. And w- could it just be the adoption process to say, okay, like, what is the end results? Because I'd imagine there's been some studies, or maybe you've seen in your career too, Jennifer, that you know people who feel more informed, more engaged through
Mhm.
that conversation process, maybe, I don't know, maybe the outcomes are better, maybe that's the recovery is better, they feel more engaged.
Yeah.
They're almost like they're this like designated partner, right, in
Right.
healing.
Yeah. There is actually research to support, like, that encouragement along the way does facilitate healing time. It does also, So in terms of how the patient perceives the injury or the condition, so their perception is less serious in a way when they receive that type of encouraging guidance and empowering communication and involvement. It's when they're told that they're not, like, if the provider is coming across as uncertain or they're not really attentive, that's where patients are kind of left feeling uncertain themselves and are not as compliant sometimes with programs, don't heal as faster post-operatively, things like that. So there is research to support that empowering communication does actually facilitate healing when you think of it from an outcomes perspective.
My guest this evening, if you're joining us in the live stream, is Jennifer George. She is a healthcare provider, physiotherapist, primary caregiver for more than 10 years. She's a consultant to health professionals and mentor to students on influential communications in healthcare. Her book is called Communication is Care. It's an excellent read. And she
Awesome.
also, before we get to a couple of comments that continue to come in on the stream, which we love, don't forget you can listen to the podcast after the fact. Just search the Arms Bumanlag Project on Apple Podcasts. Let's talk about your podcast
Oh,
and something
okay.
that I've thoroughly enjoyed. I mean, when I'm out and about, meeting donors, and I'm in the city, I'm on the road coming in from Amherstburg. I'm like, I'm gonna listen to Jen's podcast. Right?
Oh, no
Click on
way.
it, and yeah, and
Thank
it's
you.
I
Thank
find
you.
it
I
very
appreciate that.
informative,
That
and
means a lot to me.
well, God bless you. I think you do a great job.
Thank you.
How did you come up with the concept? And you've got some really interesting and very insightful guests on this too.
Yeah. So I wrote my book in 2019 and it was launched in the summer. And I touch on the provider in the book, right? And their sense of self and purpose and reflection and integrity and all of those things. And I really do believe that when providers are feeling more of a sense of self, where they feel like they have autonomy and control over themselves, that they do show up better in the patient interactions. And so for me, I felt like I didn't in the book do that enough. I didn't provide strategies enough for the provider, I guess you could say, to find their sense of purpose and to align with that and how to go about that. So knowing that burnout was increasing at that time and knowing that that was a part of the lack of communication or miscommunication in healthcare, um, I decided to start the podcast to better support providers, all of it with the intention of improving and creating empowering patient experiences. So that's kind of how it came to be. I didn't know that a pandemic was going to happen, but I
I don't
did
think
know,
any of us knew. My
and
God.
nobody knew. Yeah, but I did sense in the beginning of 2019 that healthcare was changing. I just had a feeling. I mean, I've worked on the front lines for a long time. You just, I'm sure other providers on the front line, they can sense when things are shifting. You can't define it. You can't maybe have a language for it, but you can sense that there's something changing. And who knew that it was going to be a pandemic? So at the time, the podcast started for that. So it was to help providers, improve their well-being, minimize their burnout risk, moral injury
Mhm.
risk, align themselves with the career that was meant for their purpose, and find joy and fulfillment in that throughout their journey. So I
I think
really
that's
believe like an empowered healthcare provider can empower patients. Like it's that simple.
it's not. I mean, it's not rocket science, but it is, like, because
But it
it goes
is.
back.
Yeah.
It is, right. Like it goes to, and I don't want to dumb it down, right? But for me, like
No.
I've worked in customer service in my, I mean, yeah, I did the broadcasting for 20 years, and anything I always tell folks, I'm like, anything I've done has always been about people first, right?
Yeah.
It's like, like, try to find a need, something that somebody else may be doing, another, and then say, how are they doing it? How can I make it mine? And how can
Hmm.
I do it better?
Hmm.
And I looked at, the late great, for me personally, Cam Gardner, he used to be on AM 800. God bless his soul. He was all about Windsor, and he was all about the community, and what can we do to highlight other folks. And I thought, man, I'm gonna hang my hat on that and try to do what I can. But I think when you take a look at different things, when you put people first and you do it from a lens of authenticity, I think
Hmm.
that's because people can do it, and you can measure that, right? That's where the metrics come in. It's like, okay, it's like the corporate slogan, we have to be people centric. Okay, well,
Right.
what does that really mean? Like, we can put it
Yeah.
on the wall and get some stock photos up with the mission, vision, values, but what does that mean, right?
Right. Yeah.
How are we implying that? How are we rewarding it? How do we want to empower people, not just to, okay, here's our new mission statement, but no, how do we make this really resonate with the people we want to bring on and the people
Mhm.
that we have already here so we can have those greater outcomes?
Yeah, like how do we cultivate that? It really is a cultural shift to be able to do that. And as opposed to just doing all the time, I think in healthcare we're so task focused,
Hmm.
and we kind of have to be. I mean, there's a structure that we have to, especially on an inpatient level, that we have to make things move forward, right? Um, but again, it's how do we still take the time within those tasks to still show that we care. And like you said, that authenticity, patients can sense it right away. Like they know, they can tell if someone's there for a task or if they're there to provide care, and that they're really wanting to be there at that time. So it's a hard thing to do because we all get into the profession for the purpose of helping people, and, when you go through your schooling and stuff, you're never really made aware of the greater system and how you have to align your purpose in this greater framework that you have to work in, and sometimes these barriers and limitations that you still have to be creative around. I know for me, when I have students who come into our practice or to my practice,
Hmm.
I really try to, rather than just constantly referencing knowledge, which is what they're most concerned with, is being competent, of course, and that obviously goes without saying. But one of the things I really try to facilitate is them finding their place of value in the way the system is right now, and how can they add value where they're at right now, and what do they want their future practice to look like, what now that they've seen what they've seen and they're going through this. One of the things I would love to see at some point, if education systems could consider it, is like a hands-off placement where students are just coming through and listening and engaging, but they're not worried about their skills so much, but they're just building connection, and they're just
I love
grading
that.
yeah, they're gaining greater emotional awareness of the environment and what's going on. um, those are things I try to facilitate with students who come in.
I want to touch base on that in a second. There's tons of comments coming in
Oh,
for
I
for
can't
my
see them.
guests this evening. I've been throwing them up on the screen, but I haven't had a
Yeah.
chance to kind of dive into them. But Barb here, she says, and Barb, thanks for watching this evening live. She says, not everybody's capable of this kind of level of emotional connection, but if more emphasis was placed on it, it definitely would be huge.
Yeah, it's like, Barb, it's like, when do you have time to emotionally connect as a provider? I don't know if Barb is a provider or if she's been on the other side as well of the healthcare system as a patient or caregiver, but um, that's what I was saying, right? Emotional connection is so huge right now because there's so many more determinants of health than just the physical that we have to pay attention to. And that's really seeing our patients in their full, whole human form and empathizing with all of it. Not just their condition. It goes back. I mean, this is something that has been said before, but it's really putting the person first, seeing the person first before the diagnosis. You could have two people with the same conditions on paper, and they're going to be totally different.
For sure.
And you know, and again, it's simple, but when you're actually in the practice of it and you're operating within a framework and time restrictions and resource shortages, things like that, it can be hard to do. You become more task focused rather than person focused sometimes.
My God, again, so much to unpack. um,
Warriors.
I know it's good. It's good.
I'm
I'm like trying to
sorry.
keep my train. No, it's good. I love it, Jen. I love it.
Okay.
But um, you go back to, I think that's brilliant because, you know, I I consider myself to be somewhat of a I learn by seeing. I
Mhm.
like to go and I like to see. I don't need to, like, I like to watch the interactions and pick up on the cues. And that's my, it goes back to my broadcast, right? Stuff. I like to
Yeah.
watch people how they conduct and say, okay, that was really good. And I know maybe they're really proud. I can see the uptick in their voice. They're excited about that. But I think that's brilliant to have the students come through
Yeah.
and, not worry less about the, like you said, quote unquote, hands on, but more of like,
Yeah.
how does that work with that connection? How do you build the rapport? The
Right.
rapport is huge.
Yeah. Could I share a story actually about that, Arms? This
By
might
all
put
means,
this might put it into perspective
please,
as
please do.
well. I had a student not that long ago, and he was a first year physio student. brilliant kid, like very smart. And he literally had said to me, there's two separate stories actually here. He said, Jen, he's like, I can't tell a patient that I understand what they're going through because I don't. Like, look, I'm a healthy guy. I haven't experienced anything like, what people are going through here. And so how can I do that? That wouldn't be genuine of me, right? And I commended him. I was like, that's so insightful. And you're right, that's not what you're supposed to necessarily say, because even again, if you had the same diagnosis as somebody else, you could never possibly know what someone's really going through, right? But if you're trying to, and you're conveying that you're there for them and that you want to help them through this, and that's where compassion comes in when you're thinking about solutions and guiding people through a tough time, that you're taking the time to try to listen, to give them a voice, and try to understand what they're going through, even though you can't. That's really meaningful to someone. I think to tell someone that you understand would do the opposite. I think people necessarily wouldn't feel like you could possibly understand, because really, how could you? But another story with the same student, we had a patient um, who had a neurological condition, and he was a little unsteady on his feet. And this was a person who suffered mental health challenges as well. He was kind of withdrawn, lived on his own. And one day he got up on his own and fell, and he had a fall. And so I was saying to my student that we would talk with the patient about his fall, and we would figure out kind of what happened and how we can minimize the risk next time. And the patient at first, when we approached him, didn't want to talk about it because his pride was hurt. He just didn't want to go there. And so what I had said to him at the time was, falling is actually quite more common than you realize. Like, it's not surprising that you could have a fall given what you're going through. And this could be a reality, and it would help you if we could talk about it and minimizing your fall risk in the future. So it actually took a while to break down the barrier for him to talk about it, but we did. And it took a good half hour, arms, for this, just a conversation. So we went through it. He felt more comfortable. It was an educational experience, but it was also an empowering one for him to share. And we were doing our stats, my patient and I, at the end of the day, and we had about an hour session in total. So this, my student had said to me, so Jen, so we only did a half hour of, therapy. So do we just chart it as a half hour? And I said to my student, I said, don't you think communication is care though? I said, we still spent a full hour with him. I know the first half hour was just talking with him, but that's what helped him get through the next half hour, was breaking
Sure.
down that barrier to mobilize again and get over and minimize, hopefully, the fear of falling. And after that time, he never had a fall after that. And and so for the student, it was like, holy, like, yeah, like that is care, right? The fact that we guided him through that, just even though it was verbally and through gesture and things like that. It was a powerful story. And for me as a clinician, it was like, wow, like this works, I sometimes get tired of myself, arms, talking about it. But
No, I
when I
think,
when I have these moments with students, it's like, okay, I need to keep doing, like, this motivates me more.
well, you're okay. One, I mean, you can tell when people have passion. I've always said, whether
Yeah,
you're doing construction, or you're selling houses, or you're playing video games for a living, or you're doing what you guys do, is saving lives. Okay. You
right.
can genuinely tell when somebody, and we all have bad days. God knows I've had mine. I've had my share, right? But you can tell when somebody really truly has that passion, like you said, that like, this is my calling, this is what I need to do. So from a business perspective, and I know it's different when it comes to
Mhm.
healthcare because of, funding and all that, but from a business perspective, it's like, these people love what they do. How can we empower them to continue to do what they do so they can do it well? Because if the
Right.
end user, if the end consumer is your patient, right? This is the
Yeah.
person that hopefully will advocate for, saying, "Oh my God, I had a great experience," and they it's like this, it's like a circle, right? So they
Mhm.
leave, they're feeling better, and they're telling
Exactly.
about,
So
oh my God, Jennifer George was amazing, and then hopefully you get, I want to go to Jennifer George, right? And then
yeah,
all of a sudden you're getting more and more and more patients come through. Keeps you busy. But it's, I think it, if the patient satisfactory scores are up, I mean, it feeds into the wheel of positive feedback, I guess.
totally. It totally does. And I mean, it's, for me, this is just fundamental. Like, it's just It just has to be there for me. It's a core component of care is just this the interaction is so important. And I mean, even with people who have communicative deficits, there's always a way to
Sure.
find and establish connection. And sometimes we're not going to get it all on the first, the first session, right? So I think as providers, we have to constantly keep checking in with patients, asking them, if they have questions, concerns, again, adding those personal touches along the way, things like that. I think it's not about just creating like a great outcome. It's about leaving a memorable experience. It's about touching someone's life. Like you said, 5 years later, the story that you remember about the nurse and the team
Oh
taking the
yeah.
time, like that's something that's left, you know, an imprint on you. It's enhanced your life in some way. And I really believe that's why healthcare providers get into this work is to have those moments.
And when you have tough years like we have in the last 2 years,
Hmm.
where healthcare workers have had their backs against the wall, they've been doing superhero amounts of work. Okay.
Yeah.
Um, and there's been a very thin threshold for, I think, tolerance of people are, and I get it. There's a lot of things to be angry about in the world today. Okay. You know that healthcare
Hmm.
workers are sometimes the brunt of that frustration that comes out.
Yeah.
Um, I would think that to hear that positive feedback and positive outcome stories, like, hey, yeah, so and so is doing well, or there's sort of branding that goes along, or that storytelling capability, like this was the outcome. I think that adds to that gas in the tank, so to speak, for these folks to say, yeah, we've had some really terrible things happen over the last little
Yeah.
bit, but this is something that's going to allow me to kind of come from a better place and say, this is what I want to do, and this is how I'm going to do it.
Yeah. The research actually shows that like compassionate care actually breeds and kind of shields us in a way or helps to minimize our burnout risk. That like giving compassion actually helps us as well, to minimize our risk of burnout. So for me, like there's so much going on in the world today.
Mm.
Um, there just is, and everyone's got their views and opinions, and it's hard to keep track, and it's hard not to get caught up in it all. But when I'm in the hospital where I work, like it's just me and that person right there, and it's completely non-judgmental of an experience. It's an open one, it's a collaborative one. It's one that's mutually reciprocated, where I feel like I belong there, the person feels like they belong there, and that's always the intention. And that's what helps me to get through day to day when, because we're human too, right? So
Sure.
it's we're in the system of healthcare providing care, but then we also go home to our families and our communities, and we have to deal with the realities of the pandemic and fear and things like that, like everybody
For
else
sure.
is feeling, for sure. So, and for me too, it's finding outlets. Like doing the podcast for me is something that helps me as well by helping others. Um, Writing, that those are kind of my go-tos. Physical activities big for me as well to kind of get through those moments.
Well, I
Yeah.
mean, if it's any indication for folks who are listening to this after the fact, I mean, my God, if you're looking for a great listen, check out the podcast. It's great. The book as well. Another plug for it, Communication is Care. Can't see it with my ring light, but
Thanks.
I'll just kind of hang it up, so to speak, here so you can see it. There you go. It's a great read.
There you go.
And I, I love this number 6 here. You say focus on solutions, not barriers.
Mhm.
How often can that be applied even to everyday work in any kind of field to say, how often I know in the various jobs I've had, oh, well, we can't do anything about it. And it's like this negative, like from the onset. No, 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 can't do it. Negative, negative. And it's like, no,
Oh.
let's try to find a solution. And even if it's not the right solution, we can say we tried it. And then I always used to say, let's pull a post-mortem on it and say what went wrong, what went right. Maybe it
Mhm.
was a knockout, but let's try it. Let's do something.
Right?
It's always like Jim Rohn, who I love Jim Rohn.
Yes, love Jim Rohn
Well,
too. Yeah.
right?
Yeah.
Fantastic, fantastic.
Yeah.
He says, you got to move forward. You can't
Yeah.
stand still. You have to keep moving forward. And it may not be the right for it, but you're moving somewhere. And that's still
Yeah.
better than somebody who's not moving at all?
Yeah, and he was someone who talked about investing more of yourself. He was big on that, maybe in more than compared to maybe what you're receiving, to
Mhm.
always to always invest, and that always kinda comes back. Yeah, like, again, that's a culture shift. right? Like that's a part of the component of burnout, like personal professional efficacy, where we sometimes feel like our work has no meaning because we can't change the bigger system sometimes. So we sometimes think, well, we just maybe complain about it, but we don't think about, like you said, ways to solve it, or even just use it as an experience to try to solve it and then
Mhm.
analyze the data and then just know that it's a process. I think sometimes when you think of the issue of burnout in general in healthcare, there is no one solution. And that's one thing I've learned over these past couple of years doing the podcast is there's really no one solution. And I think everyone recognizes it's a problem. Um, but no one has the one solution. But if we can change the culture and recognize that there could be solutions as opposed to just focusing on the problem of burnout and knowing that, yes, it's running rampant. What if we could just start somewhere and we start at the individual level, which is mainly what my podcast is around, which is the provider, but then you have the organizational level and then you have the systems level. For me, if I think about the systems level constantly, then I myself feel disempowered. Like I
Mhm.
feel like, so I like you said, Jim Rohn, like you just got to keep moving forward, right?
Yeah.
And hope that your message will be heard at some point. Yeah.
Yeah, it's just funny. It's like, I love those shows that are on TV. Where it's an undercover boss, where they would send like the multi-million-dollar CEO to,
Yes.
front lines to really see what day to day is, and then just even let people be heard,
Yeah.
right? I think that's huge. Just to say, here's what's working, here's what's not working, and if I've never done that particular role, I always used to when I was going from my, I guess, realm of what I know. When I was doing broadcast, I mean, I came up from producer into news reporter into talk show host, and I had a keen respect for producers
Mm.
because I came from that and I saw the changing skill set that they needed. So I would try to say, okay, like how can I figure something out for you guys? How can we make this work so you can do a great job and we can do a great job and everybody's doing a great job?
Love that. Yeah. It's
You know, it's
it's
it's just a
it's
simple thing,
simple.
right?
It's collaborative, right? It's collaborative and it has to be. And I think the conversation piece and just bringing awareness to it is just powerful, like because it's not talked enough about. And I think if
Yeah.
we can normalize the conversation around these things, I think that we could get somewhere and that we could focus on solutions. So in the meantime, like in my day to day, that's what I do with my patients, right? Because they come in from, after dealing with something very life changing, and the outlook is not very positive when they come into the hospital, right? Because there's a lot of
Mhm.
uncertainty there, there's a lot of fear there. So my part of me providing compassionate care is focusing on the solution piece with them and helping them reframe things a little differently than maybe the way they see them, and to see how they can kind of live a full life and a high quality life with where they're at right now as much as possible.
Couple more comments coming in here. John says, "You never know what someone and really their families are going through, especially being a healthcare provider. Communication and transparency is so important for patients and
Yeah.
families. Could be as simple as a smile and a handshake." Side note:
Yeah.
John is former paramedic who is now operations at Windsor Essex Therapeutic Riding Association. Great guy.
Oh,
So
amazing.
yeah, I think
Totally
it's
agree.
it's he brings up a good point, right, Jen? It's
Yeah.
those small things again, those soft skills that maybe not so soft, like like if they're not
Yeah.
just dismissed like, oh, soft skills, but it's something that we should try to just improve on and get better at.
Right. It's creating connection. Like you said in the beginning, it's that curiosity, right? That inquisitiveness as a provider as well of what our patients are going through.
So my question to you, Jen,
Mhm.
we often hear about healthcare in the future, and
Yeah.
what does healthcare look like in Ontario, or really in Canada, in the next 5 to 10 years? I honestly, there's not a day that doesn't go by, or at least a week. I'm not going to be dramatic, but you hear about the stresses on the system
Mhm.
because of COVID, because of different issues in terms of staffing and different things. Where do you think we go? Where can we go to become more patient focused?
Honestly, I think I think if we think about the bigger picture in that context, it can be a little overwhelming from a frontline perspective. I think we focus on the here and now and on the present moment. Um, we just focus on building meaningful connections in the moment that we're in right now and try not to let our, like you said earlier about the hamster wheel, right? Try not to let our anxieties and our worries take us away from that, because that's what matters right now. I have no way of knowing what the future holds, but
Mhm.
we are seeing things like, some exodus. We're seeing things like the Great Resignation happening, um, for many different reasons, and that's concerning to me because healthcare is a great profession. Like it's a great profession. It's a very rewarding one to be in. It's rewarding to the soul, and I do think that it's happening for different reasons, but ultimately if people aren't feeling aligned with where they're at, with the values with which they started their practice, I think that's a big part of why perhaps they could be leaving. So if we can bring people back to that sense of purpose again, I think that would be powerful. um, but
I know,
yeah.
I know, I know that you've interacted with so many different organizations over the last couple of years to kind of bring your message. Is it been? It's been receptive, right?
Mhm.
These organizations have said, "Yeah, Jen, this is something that we need to tackle. This is something that we want to tackle. Come
Yeah.
on in or virtually talk to some of our staff to get this going."
Yeah, and on the patient perspective too, like, organizations I've chatted with, like Crohn's and Colitis Canada, on how to create empowering connections. I think that's the next goal, ARMS, is to go more to the organizational level and,
Mhm.
the systems level, to look at moral injury and to look at burnout and to look at mental health, as accessible to healthcare providers just as much as it is to the community, right? There's a stigma out there for healthcare providers because we should know how to take care, right? It's what we do, but we're humans too, and we're humans first. And I think if we're struggling, it will impact our work for sure. So I think it's important for us to put ourselves before the stigma, to take care of ourselves, to seek the help we need,
Sure.
and to do the best we can.
You know what? Something I heard, I would say probably about almost 2 years ago, that really resonated to me, and it still resonates to me this day. If the world is consistently on fire, and if you're a candle, you're not only going to burn out your wick, you're just going to burn right to the ground. Like everything
Mhm.
can't be on fire all the time. Like you have to take the time.
Yep.
You're not a robot. You have to take the time to, we all work to provide food for our families, a roof over our head. That has to be an integral part. And I think when you speak about the great resignation, I
Mhm.
think that folks are taking a look at sort of that work life balance
Yeah.
and saying, okay, I can hustle and I can kick ass and I can do this for a particular organization and I'll do it well. But I'm
Mhm.
also going to need a trade off for this. And if those two can come together, I think that's where you're seeing a lot of this, I guess, talent. I mean, not from a healthcare perspective side, but certainly from other organizational side, saying, okay, yeah, this is the trade off, and if it all works, then ring the bell. It's on. It's a win-win for the individual, and I think it's a win-win for the organization as well.
Yeah, definitely, and there's the common goal there, like you said, the customer service, right? The
Mhm.
patient experience, that's the common goal. So coming together on that, I think could be super powerful, and I think that's the next step for sure in the future of healthcare.
What's the next step for you? Are you gonna
Oh,
like you've got so much on the go and it's all
I
good?
do.
It's just like what else is cooking?
I'm just continuing to do what I'm doing. I'm working full time, as a physio, and I love that. I love my day to day. Love the team that I work with, and yeah, I write still every day. I don't know if there will be a book in the near future. Probably another one. I'm still podcasting. I'm building more of a healthcare network on the podcasting side of things, which is good. I've
Awesome.
been doing it for a couple years, but this year I've noticed that I'm getting more outreach, people reaching out to me in healthcare, wanting to share their experiences and what's worked for them. So, I'm just going to continue to provide value where I can. Um, I also do like at the end of April, I'm hosting a debriefing with healthcare providers where they can come together and process experiences that they went through in healthcare and create a space and time for that and to offer support and empowerment, um, and just listen to one another. I think that would be healing for us too in this journey.
Just keep
Always,
doing what you're doing. I think
always.
honestly, and I mean this, Jen. Like if we could replicate your compassion and just have that sense of like well-being because you've lived it, and you want to
Mhm.
see people do well. I think, my God, I think any industry would be very, very blessed to have that kind of that love and compassion come from them if they could replicate that from you. So I think you're doing some incredible stuff. So
Thanks,
thank you so
Arms.
much for spending some time with me tonight.
Thank you so much for having me. I really enjoyed the conversation. Thank you.
A couple of comments here. Di says, "What a great conversation. These are the kind of conversations that we should be having a lot more of frequently."
Agreed.
And Joseph says, "Hey, love your weekly articles as well, Jen."
Oh,
So,
thanks. Thanks, Joe. Thanks, Arms.
oh, my pleasure. Take care of yourself, and I'm sure we'll
Okay.
be in touch to unpack more further down the road because I'd love to have you back on at a later date. Okay.
For sure. Thank you. Me too.
Thank you so much. Take care.
Good night.
Good night. Jennifer George, who is a physiotherapist and author of Communication is Care. Some simple things that Jen highlights in the book, and I think it's just incredible to create a safe therapeutic environment, prevent unnecessary conflict, reflect and grow with impact. It's like simple things that, for whatever reason, aren't so simple for sometimes. And there are a lot of stressors to what folks in the healthcare sector are doing. I mean, my God, it's incredible just to see some of the work that gets done on a day-to-day basis. If you have somebody who's gone through the healthcare system, um, certainly I can speak to my son and his journey. But we will always, like my wife and I, Carrie, will always remember the nurses at London Health Sciences and certainly at Sick Kids too, that have really resonated with us through the last 4.5 years. So Jennifer George, find her podcast too. I'm telling you, if you're driving around, it's a great listen. She's doing some incredible work as well. So I want to thank her for being a part of the show this evening. And she is local here in Windsor, Essex. Always good to catch up with her and chat a little bit about solutions, not barriers. Okay, so we got a couple of great guests coming up for the month of April. Next week, my guest, Tuesday night at 8, we're going to have a blast. This guy has traveled the world. He's local, traveled the world. We're talking Italy, Japan, Kazakhstan. I think he was in parts in Russia for a bit, all over the place. He is a world renowned executive chef. He's got hilarious and very funny stories from his time working on Erie Street over the years in the culinary scene. And honestly, one of the just nicest guys going. He will join me on the show. Don't want to let that out of the bag yet. Next Tuesday night, the 19th at 8 o'clock. So I'm really excited to have him on the show. Don't forget, we do this live every Tuesday night here in Windsor, Essex, where you can be a part of the conversation with my guests. And then you can find past episodes. We're in season 2 of the Arms, Bumanlag project. You can find us on Apple Podcasts or watch the live streams on YouTube as well. Have a great rest of the evening. Thank you so much for spending some time with me, and we'll see you back next week here on the Arms, Women Leg project. Thanks for watching.